Thank you all for joining me for my annual State of the School address. This is the first time we have held a virtual State of the School, but given the past 13 months, this is not the first virtual event for any of us. As in the past, we have provided a program which lists the names of individuals who hold or have held leadership positions within the university and the School of Nursing. It also highlights honors, awards, and recognition that individuals within the school have received. This year, the program is available electronically, and as we were unable to hold a State of the School in spring 2020, it chronicles a 2-year period from April 1st, 2019 through March 31st, 2021. Given this and what we know about shortened attention spans during virtual presentations, I'm going to dispense with my usual individual recognition of those serving in leadership capacities for the university and on the School of Nursing's Board of Visitors and our Alumni Board, and hope that each of you will avail yourself to the program. I hope you will also look closely at the many individual awards and accolades listed there. In my remarks today, rather than singling out specific individuals for particular accomplishments, I want to focus on our exceptional efforts as a school and as a team during this pandemic. I want to take as my theme the concept of breaking ground for a new way forward. Ceremonies for breaking ground, or turning the first sod, are centuries old and span cultures. The symbolism of a groundbreaking is especially apt this spring as we cautiously emerge from more than a year defined by the pandemic of COVID-19. It has been a time that we could not have imagined. Throughout January and February of 2020, the university carefully monitored the development of a new virus, and by early March 2020, the first cases were confirmed in Maryland. On March 12th, Dr. Gerald, then interim president, announced that all in-person didactic instruction would be canceled through at least April 5th, 2020, and that faculty and staff would begin teleworking. We realize now, in April of 2021, that we were indeed optimistic about a quick return to our standard operations. So here we are, more than a year later, emerging from a time that has challenged us as a School of Nursing and has challenged each one of us as individuals across our many and varied roles, both professionally and personally. I want to take stock of where we've been, all that we've accomplished, and what we have learned, and then comment on how we harness this to shape our path forward. Throughout these past months, we have continually broken new ground. We responded to a deadly pandemic, developing new ways of delivering care to our patients and our communities, inventing highly innovative methods for teaching and learning, and designing more flexible processes for how we go about our work. And all the while, we were working diligently to grapple with very real fears and ensure the safety of our students, ourselves, our families, and our communities. Through all of this, we demonstrated a powerful resiliency in the face of uncertainty and often limited information as science raced to understand an evolving public health emergency. It is not an overstatement to say that these have been truly times of historic challenge. Although our institution has faced challenges in the past, the 1918 flu, 2 world wars, and other conflicts that have called us to service, we need to stop and applaud ourselves for having persevered during this time of testing. To my UMB colleagues and the university's leadership, particularly President Gerald, who stepped into this role at a time of such great challenge and who kept us all moving forward. And to the School of Nursing's 160 faculty, 140 staff members, more than 2,000 students, over 700 faculty associates and clinical preceptors, and our many clinical partners. Thank you all for your unwavering commitment to ensuring that we were able to fulfill our responsibilities and stay true to our mission. Thank you to each of you for all you have done and for bringing us to this day. In addition, I would be remiss if I did not acknowledge the generosity of Bill and Joanne Conway in supporting the scholarship so essential to ensuring access to nursing education. And so with that, I symbolically tip my hat to each of you. I want to spend time during my remarks today focusing on some of the larger themes that have emerged as we have navigated these past months. But first, I want to note that despite many challenges, our fundamentals are exceptionally strong. In large measure, because while responding to the upending of all of our usual processes, we also stayed on track with our strategic goals and continue to meet our multiple missions of teaching, research and scholarship, and service. As I indicated, in spring 2020, although there was some early hope of a return to campus, things evolved so rapidly that the university quickly extended distance learning for all students through the end of the academic year. As it became clear that we would not be able to return to in-person classroom experiences, we needed to move all classes, labs, simulation, and clinical experiences to virtual and other modalities for what was then our more than 1,900 students. Student safety was paramount, as was ensuring that students across all degree programs could continue their academic progression and stay on track to receive their degrees. As you know, we paid special attention to those slated to graduate in May 2020 so that they obtained the necessary clinical and practicum experiences to do so. I continue to be extraordinarily proud of the work of our faculty and staff in what they did to make this phenomenal transition, and the courage and dedication shown by our students during a difficult and disruptive period in their careers. On May 14, 2020, we held a shortened and fully virtual degree ceremony for 437 students, graduating 210 BSN students, 109 master's and 8 master's certificate students, 105 D&P students, and 5 new PhDs. Quite an accomplishment for them and for us. By fall 2020, although all didactic courses remain virtual, we were able to work with our clinical partners to reopen selected clinical experiences, provided certain conditions and precautions were met. We have been extremely fortunate throughout this period to have hospital and health system partners committed to working with us to ensure that students could return to clinical experiences as soon as it was safe to do so. As circumstances have changed, we've continually adjusted our teaching and learning strategies to continue students' academic progression. At our virtual December 2020 ceremony, we graduated an additional 262 students, and at our upcoming May 2021 event, we anticipate graduating another 454. Our nimbleness in adapting to new processes for teaching and learning has resulted in more than 1,150 students staying on course and receiving their degrees. In addition to turning on a dime to reconfigure teaching and learning, we also responded quickly to the needs of the state of Maryland. At the request of Governor Hogan and with the strong endorsement of our clinical partners who welcomed additional nursing support, we developed an innovative early exit option to allow our entry into practice students to begin working as nursing graduates prior to the formal conferral of their degrees. A total of 107 BSN and clinical nurse leader students began serving under this early exit program in April and May of 2020. And we've continued to serve Maryland's needs. In November 2020, prior to the December graduation, again at the request of Governor Hogan and Secretary of Higher Education, Dr. James Fielder, we launched another early exit option. This time, all 138 students in our BSN program and 13 clinical nurse leader students, for a total of 151 students, joined the nursing workforce prior to their degree conferral. We anticipate an additional cohort of May 2021 grads, all graduating BSN students, and 14 or more of our clinical nurse leader students to respond to this third call for the early exit option. Throughout the pandemic, numerous faculty and graduate level students have volunteered and continue to volunteer. They've worked on the front lines, staffed a Shady Grove flu clinic, and staffed multiple COVID-19 testing sites in Baltimore and in the Rockville area. Now, many of our students and faculty are supporting the statewide vaccination efforts. They are serving as vaccinators and supervisory nursing staff at the Southern Management Campus Center vaccination site at the Baltimore Convention Center and other sites. The university has recently taken over the management of the vaccination clinic at the campus center. thereby enabling the staff of the University of Maryland Medical Center to return to delivering care in the hospital. We have worked with the Medical Center and with the University of Maryland Medical System as we transitioned these complex operations. We are also working directly with the Baltimore City Health Department as we continue vaccination for members of the community. UMB students from nursing, pharmacy, and medicine are gaining valuable experience in the clinic and contributing to the statewide effort to combat COVID-19. As I look back over the past year, it is clear that during this new era of COVID-19, the School of Nursing has benefited from several core strategic strengths. First, we benefited from our tremendous expertise in clinical simulation with our outstanding facilities, faculty, and staff in Baltimore and at the universities at Shady Grove. The school simulation lab in Baltimore launched more than 20 years ago, and we were early in as innovative national and international leaders in simulation. We've continually built upon this legacy through renovation and expansion of our facilities at both locations and increases in our faculty and staff. Our exceptional simulation team made numerous and repeated adjustments to respond to changing circumstances and kept learning experiences on track for our students. They replaced in-person clinical activities by assessing, acquiring, and implementing new software able to simulate nursing scenarios through virtual patient encounters. This has been a groundbreaking effort with implications for longer-term enhancements to student learning beyond the pandemic. Second, we have benefited from the enormous strength and skills of our faculty, a very large number of whom were already well-versed in how to teach in an online or virtual environment. Data from a university survey of faculty last summer indicated that across the university, 37% of faculty were teaching online prior to COVID-19, whereas 65% of those at the School of Nursing were already doing so. For all university faculty, 79% reported teaching virtually or online after the onset of COVID-19. For the School of Nursing faculty, it was over 95%. This is a testament to our strong information and learning technologies infrastructure. This includes the expertise of our instructional learning staff who guide and support faculty, as well as the many knowledgeable faculty members who provide peer support to their colleagues. It also includes our longstanding institutional commitment to research and education and best practices for teaching and learning, and our strategic focus on engaging faculty in programs that support and continually develop their teaching expertise. There have been multiple other demonstrations of our ability to respond to the challenges. We became experts at procuring personal protective equipment, and we developed systems for teaching students proper procedures for donning and doffing their PPE. We pioneered systems for tracking COVID-19 testing and daily symptoms among our students, faculty, and staff, and our early efforts on this became an integral part of the university-wide daily safe screening system. We hired 2 infection control specialists, one to oversee a comprehensive school-wide approach to monitoring, including tracking and following up on positive test results or reported symptoms, and the second to support student and faculty safety through the acquisition and deployment of personal protective equipment, including fit testing for N95 and half-mask respirators. Given the abrupt changes to business as usual, we should be especially proud of how we sustained our core activities. Our admission and enrollment statistics have been exceptionally strong. As COVID-19 took its toll throughout spring 2020, there were concerns and anxieties about the impact on admissions. However, with incredible diligence on the part of many individuals, including creative strategies for continually communicating with and engaging applicants and admitted students, our final enrollment across all programs for fall 2020 was 2,084. This is the highest in the history of the school and a 5% increase over the fall of 2019. It is a significant accomplishment and points again to the strengths of our team and their capacity to adjust, providing real-time, on-the-ground innovation in enrollment and retention strategies. The strengths we have exhibited are not to be taken lightly. They have been essential to our ability to pivot, maintain continuity of operations, and stay true to our missions. It has been a heroic team-based effort involving tenacity, problem solving, and innovation to respond to a constantly changing set of demands. Research is another critical activity where our fundamentals continue to be strong. Despite the pandemic, we have not missed a beat. In fact, our grant activity has soared. At a time when grant submittals might have been diminished, our volume of new submittals for fiscal year 2020 was 10 million, with 89 grants submitted, 18 of which were submitted to the National Institutes of Health. During the most recent federal fiscal year, we remained in the top 20 schools of nursing nationally for NIH funding, with a ranking of 11th for public schools and 17th for both public and private schools of nursing. NIH funding is only one piece of the school's overall grants portfolio. UMSON faculty also received over $9.6 million under Maryland's NSP2 program, which is funded by the Health Services Cost Review Commission and administered by the Maryland Higher Education Commission. These NSP2 projects are central to how our leadership role as a state institution plays out. They reflect our commitment to increasing the number and capacity of nurses in Maryland and to expanding the number of nurses prepared to serve as faculty at the University of Maryland School of Nursing and throughout the state. As we look back, it is clear that we have continued to excel in teaching and learning, in service, and in our research and scholarship. And through this, we have continued to fulfill our mission on behalf of our students, our communities, and the state of Maryland. I want to shift gears now for the final portion of my remarks and talk about the road ahead. As I've indicated, our experiences during this pandemic displayed our perseverance, our capacity for innovation, and our courage. There's a great deal we've learned about our ability to pivot to address complex challenges. Just a month or two ago, we had a virtual groundbreaking for the expansion of the School of Nursing Student Services area on the Baltimore campus. We could not gather as a group in celebration, but several of us posed for the camera individually, putting our shovels into the ground in the courtyard facing Lombard Street. We then created a montage of drawings taken from the individual images to capture the occasion. I am sure it was a very different groundbreaking than what we've ever had before. But the experience prompted the thought that we had actually been breaking ground for many months, creating new ways of thinking and doing, and learning new things about ourselves and our society. As we begin to return, I think we all realize that we are not the same people who left here 13 months ago. We've had many different experiences, heard many stories, and been immersed in data and statistics. We have learned about those who survived and those left behind, sometimes ill-served by our healthcare system and other societal systems. There are things that we cannot easily set aside, nor should we. Taken as a whole, our experiences argue for reflecting how we go forward as we move out of the pandemic and chart our future course. We are not alone in this. All over the country and throughout the world, people are seeing their lives and their work with a different sense of purpose. So what does this mean for us? And today, I want to focus on 5 key areas. First, diversity, equity, and inclusion. When I arrived in 2013, I said I wanted my legacy to be that we made the school a better place to work and learn, a place that values inclusiveness, civility, and respect. We have done a lot of good work, and in 2016, we led the way for the university in creating a senior level position for diversity, equity, and inclusion. Our strategic plan has included priorities for increasing diversity, equity, and inclusion, as well as related priorities for ensuring student success and fostering a strong and diverse faculty and staff. But the events of the past year have shown we need to go beyond this. The disproportionate impact of COVID-19 on so many in our society has heightened understanding of the need for a more equitable healthcare system. During this pandemic, the impact of inequality has been writ large in the statistics and the daily stories of who was sick and who was dying. We strive as a school and individually, through our teaching, research, and service, to address issues such as the social determinants of health, the need for access to comprehensive healthcare services, the importance of cultural competency, and the overarching need to address structural racism. But we will need to make this an even higher priority going forward. In addition to the ongoing inequities in our healthcare system, last spring we were challenged by the images of the brutal actions against George Floyd and so many others. These challenges continue now on an almost daily basis, along with the recent terrible attacks against Asian Americans. As we discussed the events around George Floyd's death, individuals shared with us experiences that they had had, which many of us could not even fathom. It brought home the fact that we have colleagues whose lives, no matter how accomplished, are lived in the ongoing shadow of structural racism. Since then, we worked to develop a deeper understanding of our history and the violence that has occurred over decades in the pursuit of a fair, just, and equitable society. We have been deliberate in asking ourselves what we need to do to better understand, what we need to change, and what steps we need to take to move towards our goals of diversity, equity, and inclusion for all. Again, we're not alone in this. These conversations are occurring across our university and throughout our country. But as a School of Nursing, we're uniquely able to lead with respect to how to shape nursing education and practice. This includes how we ensure access to nursing education and its success for each member of our diverse student body, how we foster diversity and inclusion among our faculty and staff, and how we continue to support much-needed research and scholarship to inform and improve the practices of nursing. We are well positioned for this, one of the oldest and largest schools of nursing in the nation, as active leaders and participants within the profession at the state and national levels. And most of all, because of the ability to pivot, to persevere, and to innovate that we've just demonstrated over the past 13 months. By leading and advocating in this area, we have the capacity to shape nursing education and the delivery of healthcare for many years to come. Second, living and contributing to our global world. You may recall that 2020 was designated by the World Health Organization as the International Year of the Nurse. And what a good year they picked for that. If this pandemic has taught us anything, it is that we are indeed a global society and that nursing, as the largest healthcare profession in the world, has a major role to play in ensuring that we are meeting the most basic needs of all people. Our global responsibilities are, in many ways, a larger, broader version of our responsibilities for ensuring a just and equitable healthcare system here in the United States. We are fortunate that we have so many talented individuals at the School of Nursing and across the university who are dedicated to addressing global health issues. And we are fortunate to have visionaries who understand that the United States, as fortunate as we are, does not have a lockhold on the expertise or solutions for meeting the needs of its people. The move to apply global learning to local issues, which is happening here in our West Baltimore neighborhood, is a sign of our deep respect for the knowledge and insights that practitioners across the globe can share with each other. We are indeed part of a global nursing workforce. In fact, we are proud to have alumni in 39 countries. As a School of Nursing, we offer our students exceptional educational and service learning experiences that prepare them to be citizens of a larger world. But as always, there is more to do. Collectively, we face the challenges of securing access to the most basic healthcare services for much of the world's population, as well as the threat of future pandemics, rapid global spread of disease and illness, and perhaps the ultimate threat to our public health, a planet no longer inhabitable for millions of people. Third, discovering and applying new knowledge. We excel in the development of doctorally prepared nurses through our PhD and Doctor of Nursing Practice programs. Through our DNP program, we're meeting the national need for nurses equipped to manage increasingly complex care across multiple sites and to improve nursing practice. Through our PhD program, we're ensuring the ongoing growth of nursing science. We are fortunate to have researchers in multiple areas, from bench to bedside to community, expanding our knowledge of new methods for treating disease and illness, and for keeping individuals healthy and functional. This is a great strength, and coupled with our strategies for nurturing young researchers, we're positioned to continue to make significant contributions. Fourth, accelerating adoption of new ways of teaching and learning. I've talked a great deal already today about our prowess in teaching and learning. All of the innovations that we explored and embraced as we pivoted to meet our goals and our mission have left their mark. There are many industries saying that the pandemic moved them 10 years and 10 months. And certainly we know that we've adopted new practices faster than we might have under normal circumstances. This affirms our capacity for innovation and new thinking. This new thinking will be needed over the next several years as we implement curricular changes to meet the new essentials for nursing education. The standards for what constitutes preparation to be a nurse are shifting from a focus on what one knows to a focus on what one is able to do with what one knows. It means that we'll be graduating students who require enhanced critical thinking, decision-making, and leadership skills, and this will require changes in teaching and learning. Fortunately, we've had a long-standing commitment to the science of teaching and learning. We excel at developing best practices grounded in rigorous analysis and then disseminating those to others and putting them into practice for ourselves. As we face new requirements for nursing education and an ever-changing and increasingly diverse population of learners, our scholarship in teaching and learning is an essential advantage. As we also respond to the need that even the most experienced of nurses have to continually acquire the new knowledge and skills required for a rapidly changing healthcare system, there's a great deal that we can contribute. Fifth, the future leadership of nursing. All four of the preceding items relate in some way to the future of nursing, but there is a larger issue related specifically to the future leadership of nursing. Nursing, given its origins in caregiving, does not typically spend a great deal of time tooting its own horn. We take the commitment to serve others as an essential part of our professional oath, and with this comes a humbleness that I believe is characteristic of the discipline. Nursing exemplifies servant leadership, and during this past year, I think that has certainly been proven to be the case as we look at the role that nursing has played at the forefront of the response to the COVID-19 pandemic. But the soon-to-be-released consensus study from the National Academy of Medicine, in partnership with the Robert Wood Johnson Foundation, The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity, will launch a new set of challenges for nursing and provides new opportunities for leadership. The preceding report, covering 2010 to 2020, outlined a bold set of initiatives that significantly reshaped nursing education and led to tremendous statewide and national changes. These are very familiar to you because they shaped our work and practice as well. They included increasing the number of nurses with baccalaureate degrees or higher, doubling the number of nurses with doctoral degrees prepared for advanced practice, teaching, research, and scholarship, increasing the diversity of the nursing workforce to make it more reflective of the population, and increasing interprofessional education. We accomplished a great deal in addressing these challenges. The 2020-2030 report will further extend the vision for nursing to one of creating a culture of health, reducing health disparities, and improving the health and well-being of the population. It will call for responding to the root causes of health inequities and charge nursing with taking a leadership role in accomplishing this, including increased attention to community engagement, community health improvement, and population health. In many ways, this reflects a role that nursing health played early in the 20th century, prior to the emergence of a hospital-based focus on medical cures, which came to dominate healthcare in nursing. Just as the prior report prompted significant change, this new report will provide the opportunity for nursing to truly position itself at the intersection of science and societal needs, and to engage in the development of far-reaching solutions to the inequities of the current healthcare system. This will be an exciting time for the nursing profession as it too charts a new path forward. As I look ahead, based on all that we've accomplished and learned during the pandemic, I have every confidence that we will be able to address challenges and exercise a leadership role in shaping the future of nursing and the future of healthcare for Maryland, our nation, and on a global basis. So as I conclude my remarks, I again salute each of you for all you have done. Together, we've demonstrated that we have a capacity for action and innovation that is far greater than what we might have imagined. And as we emerge from the pandemic, we have the opportunity and, in fact, the calling to continue to make a difference in the lives of the individuals, families, and communities that we serve. Thank you immensely for all that you have done and all you will do in the days and months ahead. I anxiously await the opportunity to work with you in person in Baltimore and at Shady Grove during this summer and in the fall as we return to campus and continue to break new ground together. Thank you.